Tonight's main event, we have Russ from Elanco that's going to be sharing some information on both heartworm disease and then common intestinal parasites. And I'm going to go around today with the microphone. So this is for everyone who's joining us on Facebook Live. And if you have questions and things, just raise your hand. I'll run over with the microphone and let you ask your question during the presentation. But thank you, Russ. We're excited to hear what you have for us today.
Thank you so much. I'm excited to be here. Thank you to Dr. Pam and all the staff members at Animal Care Center to let me come and talk about it. Like Dr. Lindsay said, I'm Russ. I'm from Elanco. Parent company is Eli Lilly. They're a pharmaceutical company. The animal health division of Eli Lilly is Elanco, and that's who I work for. Our product that we sell, that Dr. Pam sells, is Interceptor Plus, and so we'll be talking about internal parasites, heartworm disease, and how Interceptor Plus plays a role in those. So we'll just start off heartworm and heartworm disease. So nationally, there have been over 90,000 cases of heartworm dogs that are heartworm positive in 2014. Does that seem like a lot of heartworm positive cases to you guys across the country? Yes. I don't know how many dogs are across the country, but that's a good question. But over 90,000 cases were reported in 2014. And actually that number has come down. Before it was higher than that. It's come down because more people are actually aware of heartworm disease and are preventing it with monthly preventatives. The number recently has actually started to climb again. And the reason why is when we have natural disasters across the country, those dogs are being rescued and transferred across the country. And when they're transferred across the country, they bring heartworm with them to places like here in Utah. Now these, like I said, these are reported cases, so the numbers are just a little bit skewed because there's many cases that aren't reported and many cases that aren't diagnosed by veterinarians either. So these numbers are lower than what they are in actuality. So heartworm has been reported in all 50 states. It is transmitted by the mosquito, so it cannot be transmitted from dog to dog. There has to be a vector in between the dogs, which is called the mosquito. And there's over 70 different species of mosquitoes that are capable of transmitting heartworm disease. There are many different types of hosts for heartworm. If you think about any of the wild canine species, so coyotes, foxes, wolves, they will all harbor heartworm. There are many other animals that can harbor heartworms as well. Raccoons can harbor heartworm, bear can harbor heartworm, even sea lions can harbor heartworm. So we don't have to worry about too many sea lions here in Utah though. And all of these are harboring heartworms, which are reservoirs for our dogs. These heartworm, they're reservoirs for our dogs catching heartworm. So a lot of people, they take a look at Utah and they say, oh, we don't have heartworm here in Utah. And actually we do. Like I said, it's been reported in all 50 states. And there's a great website. It's called capcvet.org. That stands for Companion Animal Parasite Council. So capcvet.org is where you can go to. And it'll actually give you maps, and it can break down to each state the prevalence of heartworm, and it can actually break it down to each county the prevalence of heartworm. So this is a map, and this is a little bit old. This is 2015. If you take a look at Utah up there, it's listed at a moderate risk. So it's even higher than the light risk. It's a moderate risk. I'm going to go ahead and take you guys to their website. This is CAPC's website right here. You can do this for tick-borne diseases, heartworm, internal parasites. I switched it to heartworm. And here we are with the map of the United States. And again, you can see Utah is a moderate risk. We click on Utah here, and it breaks it down to the counties that you can actually see where heartworm's being reported at in the counties and everything. The CAPC website, a great resource to show your clients. Let's talk a little bit about heartworm and its life cycle and how it's transferred from one dog to another dog. So we have a picture up here, and we have a dog that is positive with heartworm. We've got that yellow lab. He has heartworm. And since he is positive with heartworm, he has little baby heartworms circulating in his circulatory system. These little baby heartworms are called microfilaria. And the microfilaria is going through his blood system, his circulatory system. A mosquito will come down, take a blood meal from that yellow lab, and suck up those microfilaria. Once it sucks up those microfilaria, they will actually molt inside the mosquito's gut 2 times, from microfilaria onto an L1 stage, and then an L1 is the microfilaria, to an L2, and then an L2 to an L3. The L3 is the infective stage of heartworms. That's where it's actually transferred from the mosquito to the dog. So this mosquito then will come up to this white terrier on top, and it will take a blood meal. When it takes a blood meal, it has the L3 parts of the heartworm come out of its mouth parts and go into the dog through the puncture wound that it left in the dog's skin. It will migrate through the dog's tissues and the skin into the circulatory system, and then it'll make its way into the arteries. And once it reaches the arteries, it will start to mature and grow and get bigger. I have another slide here that talks a little bit more in detail about the life cycle and the days that go between it. As you see, we have the L3 to the L4 stage. Those are where the microcyclic lactones, those are the active ingredients inside the heartworm prevention that actually kill the heartworm. It kills them in the L3 and the L4 stage. So these heartworm preventatives are just that, preventatives. They will not remove heartworm if your dog already has it. It will not kill adult heartworms. It will prevent your dog from getting heartworm, and it kills them at the L3 and L4 stage. So it's pretty important that these preventatives are given monthly because they reach back. They have what's called a reach back effect, and they only kill on the L3 to L4. So my next question is, how long does the microcyclic lactones in the heartworm preventative actively kill heartworm in the dog system? So once you give a dog your monthly preventative, how long does it actually kill the heartworms for? Does anybody have a guess?
30 days.
30 days, that's a good guess. Anybody else? 1 to 2 days, I love it, yes. So 30 days, that's what most people do say. They say 30 days because that's what we recommend you giving a heartworm preventative to, is every 30 days. But the microcyclic lactones are only killing 24 to 48 hours. And then it's excreted through the dog's system. So it's really important that you give this every single 30 days because if you miss 30 days, you can get past the stage that the macrocyclic lactones will actively kill the heartworm. So we have the L3 and L4, and then once they will migrate through the muscle fibers and through the tissue and get into the veins. Once they get into the veins, they'll move into the circulatory system, and by day 50 to 70, they actually reach what's called an immature adult heartworm. Think of that kind of like the teenager heartworm. Once they reach that immature adult heartworm, the microcyclic lactones will not kill them. It is too late, and they will mature into adult heartworms. At day 67, they will arrive in the pulmonary artery. Now, the pulmonary artery is between the lungs and the heart, and that's where they like to hang out. And then day 120, the female heartworms will actually become sexually mature, and they can reproduce. And then they become adult heartworms and have microfilaria circulating in the dog's blood system by day 180 to 270. So, yes, a question.
The L3 and the L4 always produce a male and a female?
The L3 and L4, do they always produce a male and female? No. So they are, they're either a male or a female. So they...
Have just males circulating?
You can.
Just females?
You can have just male circulating, and you can have just female circulating. And I'll talk a little bit about that when we talk about heartworm testing and testing for heartworms. Good question. Thank you.
And that's especially important in our cats, too. Will you touch on that, too?
Yep, I'll touch on that. Yep, very important in cats. Yep, and I'll talk about that when we go into testing for heartworms. So let's talk about monthly preventatives and why it's important to give it every 30 days. So for example, let's say our dog got a heartworm preventative, they were given Interceptor Plus June 1st. And July 1st came around, we forgot to give our heartworm preventative, and now it's all the way August 1st. And we thought, oh my goodness, we forgot to give July, now we go ahead and give August 1st. Well, that's been over 60 days. We have June, because it's only killing 24 to 48 hours, so it's only in the system for 1 to 2 days. We went all unchecked the rest of June, all unchecked July. Now we're into August 1st or 2nd. You give the Interceptor Plus, and we're past this 50 days here. And potentially, those baby heartworms, the L3 and 4, could have matured into an immature adult heartworm where they will not kill them. Does that make sense? Does anybody have questions on that? That's why it's very important to always give your heartworm preventative every 30 days. If you forget and you're in the middle of a month, give it as soon as you remember. The sooner you give it, the better, because the less chance it has of maturing to an immature adult heartworm. Okay, I've got some follow-up questions just to make sure you guys were listening. So the first question is, what are the potential consequences of missing a dose of heartworm preventative? You'll miss the kill period. Exactly. Thank you. Yep. How long are the microcyclic lactones actively killing against heartworm once they're given? 1 to 2 days. Yes, good. You guys are listening. Thank you. So another review real quick. Adult heartworms, they live in the pulmonary arteries and the microfilaria. They circulate through the blood system, and they can cause different problems for dogs. So these are some clinical signs that you'll see in a dog that is heartworm positive. Like I said before, the heartworms like to hang out in the pulmonary artery right between the heart and the lungs, and that causes the dog so it can't, almost like it's out of breath, shortness of breath, coughing, wheezing. So these are some of the clinical signs that you can look for. So let's talk about testing for heartworms, how we actually test for a heartworm. So the majority of clinics use what's called a SNAP test, and it looks kind of like this up here. And what it does is it actually looks for a protein in the female heartworm's reproductive tract. And once it detects that protein, it gives you a positive result. The best thing, and I know Dr. Pam, she sends out for heartworm, and that is much more accurate because they can actually test for both male or female heartworms. And so what Dr. Pam is doing in Animal Care Center is the best practice of medicine. The problem that Dr. Lindsay mentioned is with cats, they usually have a very low heartworm burden. Dogs can harbor many times over 50 heartworms at a time. Cats can harbor 1 to 2 heartworms at a time. They're just not as good as a host as a dog is. So with that low burden, 1 to 2 worms, chances are that they could be male worms and not have a female worm there. Therefore, it would not show up because it's looking for the protein in the female's reproductive tract. Yes? What makes cats not as good of a host as dogs? And they have a better immune system. They can fight off the heartworms better. But a cat getting a heartworm is a really big deal because it can be fatal with a small burden of 1 or 2 worms. Where a dog can harbor many more worms and it's not fatal. Often it can be fatal, but not as much as a cat.
Does the size of the dog matter?
Does the size of the dog matter? And yes, it does matter. A larger dog can harbor more heartworms. A smaller dog will harbor less. Yeah. So.
But a small dog that's the same size as a cat can still tolerate better than a cat.
Yes, a smaller dog that's about the same size as a cat can tolerate the worms better than a cat, and that's yes. So how do you treat for heartworms? How do you guys do it here at Animal Care Center? What do you guys use to treat for heartworms? Imidacide? Yeah.
Injection protocol for imidacide.
Okay, great. And that's really kind of the standard protocol of to treat for heartworms. So it can be very expensive. It can be painful to the dog. And it can be fatal. It can be fatal. It can be fatal, yes. The good news is that it is effective. most of the time it will kill the heartworms, but the dogs have to go through quite a bit. Let's talk about expensive first. I've heard a lot of times that clients say, I don't like to buy heartworm preventative, it's really expensive. Well, if your dog gets heartworms and they have to be treated for heartworms, it is a lot more expensive. What we say is you can buy your dog heartworm preventative for 7 life cycles of that dog versus 1 treatment of imiticide, the 3 injection protocol of imiticide. So it's quite expensive to treat for heartworm. Not only that, it's very severe on your dog, it's painful, they have to be exercise restricted. The reason why they have to be exercise restricted is because those heartworms, when you're killing off the heartworms, they slough off and they go through the circulatory system until they get blocked, and then they can cause a thromboembolism. And once they cause a thromboembolism, it can kill the surrounding tissues. And that can be fatal to a dog if it gets into certain areas. So you want to limit your dog's heartbeat and limit how much its heart is pumping and pushing those worms off as they're dying. And that's why you want to have them exercise restricted. Sometimes even just an owner coming home from work and the dog's in the kennel can get it very excited and have it to cause those worms to slough off. And so sometimes they need to actually be boarded or crated outside of the owner's home. And that interrupts the human-animal bond, and this takes quite some time, about 2 to 3 months to actually kill off all the heartworms. So 2 to 3 months that your dog's going through this.
I was going to say the heartworm recommendations for the guidelines is at least 3 months while they're receiving the injections, a very minimal leash walk only, in a crate. They do nothing for 3 months. Think about that in a young dog that's super active. I mean, that's just emotionally very tolling on these dogs.
Absolutely. Thank you.
What causes the pain? What is painful about it?
It's painful because you're putting these chemicals that are ejected into the dog, and it's killing these heartworms. And it's painful. It's in the system, and it's causing havoc to the dog's system.
It's a huge intramuscular injection given in the apaxia muscles at the back. It's the only place you can give it. Super painful injections, like sedation to the point. Like, it's nasty bad. It's not being over exaggerated. It legit is. And it's like a chemotherapy, so they're achy, they're grumpy, they feel like crap. You would never want your dog to go through that.
The last patient we just treated was a transfer. She came up from Texas, and we just treated her. She was so sick. She was literally shaking and felt horrible after her injections. We do everything that we can, but they get so sore and painful. It's brutal.
So here's some more questions. How does a dog acquire a heartworm infection? Mosquitoes, yes, thank you. And can heartworm disease be transferred directly from one dog to another dog? No. You have to have the mosquito in between, the vector. Yes, you're right. And at what stages in the heartworm life cycle do the heartworm preventatives work or kill the heartworms? The beginning, the L3 and the L4 stages. Yes, you're absolutely right, the beginning. I'd like to show just a real quick video. This is a video on YouTube that has actually been put out by our friends at Bayer.
The health of dogs is at risk from heartworms, a major parasite transmitted by infected mosquitoes. The infection of the dog starts with an infected mosquito taking a blood meal. Infective third-stage larvae, L3, of the parasite Dirofilaria immitis are deposited on the surface of the dog's skin. Immediately afterwards, these L3 larvae, about 1 millimeter long at this stage, enter the dog's body using the puncture wound left behind by the insect. In the dermis, the heartworm larvae undergo the next stage of their life cycle and molt into L4 larvae as early as 3 days post-infection. During the following weeks, the L4 larvae migrate through the tissues of the dog. At day 50 to 70 post-infection, L4 larvae molt into immature adults. As early as 70 days post-infection, The immature adults migrate into the dog's venous bloodstream, which transports them towards the heart and lungs of the dog. By day 120, after the initial infection, they all have arrived in the small pulmonary blood vessels. At this point, the immature adult heartworms are about 1 to 1.5 inches in length. They now begin to grow massively, pushing into larger and larger pulmonary blood vessels until some of them finally end up in the pulmonary artery, close to the heart. An inflammatory process within the pulmonary vessel and surrounding pulmonary tissue is elicited by the parasite. This progressively leads to pathology of the lung and the blood vessels, ultimately resulting in vascular resistance or pulmonary hypertension. With higher worm burdens, right heart hypertrophy develops, leading in the long term to right-sided heart failure and potentially to the death of the affected animal. Heartworms are also responsible for a marked increase in the dog's risk of thromboembolism. Once a worm dies, it can block a smaller pulmonary vessel completely, resulting in the infarction of the surrounding tissue. About 7 to 9 months post-infection, the adult, now sexually mature female worms start producing offspring. The microfilaria stage L1 of Dirofilaria immitis. These microfilaria circulate in the cardiovascular system of the infected dog, ready to be ingested with the blood meal of a feeding mosquito. Inside the insect, over a period of about 14 days, the L1 larvae develop into the infective L3 stage larva by molting twice. This mosquito is now a new vector of heartworm infection, threatening the lives of dogs and cats in endemic areas.
So we'd like to thank our friends at Bayer there for that great video. Do you guys have any questions about heartworm or heartworm disease? Why do humans not get it? Our immune system, we're not a very good host for it. Sorry. Yeah, so humans aren't a very good host for it. Our immune system kills them off and gets rid of them. So yeah. Did you have a question?
Well, years ago, I was told by a vet that in Utah, we only had to do the interceptor like from April to October.
Yes?
Is that still the case?
That used to be nice. I have a great example that many people think that, and just recently, Copperview Animal Hospital in Riverton had a dog come up positive that was treating just 6 months of the year. And what happened is October, they gave the last dose around October 1st. Utah, we have very funny weather patterns. We still have many warm days in October. And as we know, the microcyclic lactones are only killing 24 to 48 hours. So the last dose was given October 1st or 2nd, 24 to 48 hours. And then Dr. Stefanoff, the doctor there that was on the case, he guessed that probably around October 10th or so, the dog got bit by a mosquito that had the L3 form, infected with heartworm disease, and it went unchecked all winter long until they came back in March, April, to buy their 6 months again. They gave a heartworm test, and it came back positive. So it's just when the mosquitoes are out that you have to worry about it. And we have very funny weather patterns. And you know, we have many times that it's warm in October, November even, that can have mosquitoes out and be transferred with heartworm. Now that's if you're only concerned about heartworm disease. The Interceptor and Interceptor Plus also protect about internal parasites that can be transferred year-round. It doesn't matter if it's freezing outside and 6 feet of snow, they can still be transferred from dog to dog. And there's zoonotic risk as well, where that means it can be transferred from animal to human. And I'll talk a little bit about internal parasites now and why we want to protect year-round.
Russ, online, April Levitt asked what the side effects of heartworm prevention are. Her dog has never been on it. And April, if you're listening, my experience is heartworm prevention side effects are very, very small and few and far between. Occasionally dogs will vomit. You want to give her more information about that?
No, Dr. Pam, you're absolutely right. Very, very few and far between are the side effects. We do recommend taking your dog in to see the veterinarian and getting a heartworm test beforehand. And that's just for the fact that these heartworm preventatives, they will kill the microfilaria that are circulating in the dog's circulatory system. And if your dog has a big burden of microfilaria circulating in its system and it kills those, it can send the dog into shock. That's very, very rare and hardly ever happens, but we do recommend you going into the vet and having the vet test your dog for heartworms beforehand.
The only other caveat I will say, talk to your veterinarian if your pet has any food-specific allergies, because it is a flavored tablet, so we can go over which heartworm prevention is best for your pet.
Absolutely. Thank you.
Because we do run across that a lot.
That's 200.
Oh, she didn't have the microphone.
Yes, so Dr. Lindsay just said that if your dog has any food allergies, to come in and discuss with your veterinarian what allergies your dog has, because they are flavored tablets. Interceptor Plus is a chicken flavored tablet, and so it's safe for dogs with beef allergies, and some of the other products are actually beef flavored. So you want to find out what, talk to your veterinarian first. Any other questions on heartworm or heartworm disease? Okay, we'll go ahead and we'll move into internal parasites or intestinal parasites, and we'll talk about these. While I'm talking about these, I want you guys to look at this picture up here, and I want you to kind of put this in your mind. It's a picture of a little boy in a backyard playing in the dirt with his Tonka trucks and the dog. Pretty typical scene that you could see across the United States. So let's talk first about roundworm. Roundworms are going to be the most common internal parasite that we find here in Utah. They're the ones that we're going to see the most besides tapeworms, and I'll save tapeworms for the last. Tapeworms are the one that we're going to see absolutely the most. Roundworms will be second. But almost all puppies are born with tapeworms. They get it from their mothers. They can get it from nursing, and they can get it transplacenta, so in the womb from their mothers as well.
You meant roundworms, right?
Roundworms, yes. What did I say?
You say tape.
I'm sorry. I said. Thank you, Dr. Pam. I appreciate it. Roundworms. Thank you. So roundworms are the most common. Tapeworms are the most common. Roundworms are the second. Most puppies are born with roundworms because they get it from their mother, and a heavy burden of roundworms can actually kill a puppy. So this is what a roundworm egg looks like underneath the microscope. It's nice and round, has a pitted appearance. That's where it gets its name, roundworms. They're effective within 4 weeks, and they have a very, very hardy resistance to the environment. They can stay in the environment anywhere from 5 to 7 years. They can survive through the freezing winters. They can remain there for many years. So if you think about it, a dog who passes roundworm eggs out into the environment, well, that poop is going to go away, and the yard's going to look nice and clean, but those roundworm eggs are there for 5 to 7 years. The problem is that roundworms are zoonotic, and because they're zoonotic, that means that they're a risk to humans. And when humans get roundworms, infected with roundworms, they migrate up into the eyes and they cause you to go blind. So the CDC, which is the Center for Disease Control, has roundworm as one of the top 5 preventable diseases. There are over 50 cases of people in the United States every year going blind from roundworm. That's not just getting roundworm, that's actually going blind from roundworms, which is really sad because it is a preventable disease. In developing countries, it is much higher of a risk just because the hygiene standards aren't quite there as in the United States. So these are more pictures of roundworm eggs. Let's talk a little bit. We talked about how they're persistent. They stay in the environment anywhere from 5 to 7 years. They survive through the freezing winters. They do not do well in direct sunlight. But if they get underneath the layer of grass or underneath the first layer of soil, that's where they do really well. And they can survive for 5 to 7 years. Let's talk about some clinical signs of roundworms in dogs. These are clinical signs. That first top picture is of a puppy that has a large roundworm burden. He has a big potbelly appearance because he has a lot of roundworms. The second picture on the bottom is the one of roundworm in the dog's GI system, and those are roundworms right there. And these are clinical signs that you can look for. Let's talk a little bit about the life cycle of the roundworm here. So we have the mother dog, which is roundworm positive, and it can actually transfer it transplacenta in the womb to the puppy, which is number 8 up there. Number 9 is its nursing. The puppy can actually get roundworms from the mother from nursing. And then you can see that the dog poops out the roundworm eggs into the environment, and that's number 2, and then to the 3, the roundworm eggs are in the environment, the roundworms are in the environment. They can then be ingested by an animal or ingested by a human. Think of that little boy in the backyard digging in the dirt with his hands, and there's no poop anywhere, but those roundworm eggs can survive, 5 to 7 years. Where do little boys and girls put their fingers? In their mouths. He has Tonka trucks. He's driving his Tonka trucks. They suck on the tires of the Tonka trucks. That can go right into the little boy or girl. We have small rodents, mice, voles can actually eat the roundworms or the eggs. And then if your dog hunts and kills a mouse or a vole, they can actually get roundworms that way. Earthworms can actually pick up roundworm eggs. Yeah, kind of strange to think a worm can get a worm inside of it. So earthworms get it. If the dog eats the earthworm, or even the little boy eats the earthworm, they can get roundworms that way as well. So lots of different ways. So real quick, let's go back. I'm going to use my dog as an example. My dog is, he's a lab. He likes to eat just about anything, and I like to go hiking with him. And one of his favorite treats, and I don't know why it is either horse manure or cow manure. He loves to go up there and sniff it and take a taste out of it. And he can actually get roundworms that way. He can get tapeworms that way. Lots of different things that he can get that way. So this is the next worm right here we're going to talk about. And I'm going to ask you guys, when you see that picture, what's the first thing that you notice or you see of that picture? Yeah, he's got big fangs. That worm has big fangs. Can you see those teeth up there? This is the hookworm. And hookworms are voracious blood suckers. They actually suck blood and cause all kinds of problems for dogs. So this is the most common worm, internal parasite, across the United States, minus the tapeworm. Here in Utah, it's going to be second to the roundworm. The roundworm is what we're going to see the most of in Utah. And like I said, they consume large amounts of blood. This is the hookworm's life cycle. So the scary thing about hookworms, there's a good thing about hookworms and a scary thing about hookworms. The good thing is they die off during the freezing winters. They cannot survive the freezing winters. The scary thing is they do not need to be ingested to get them. They can actually burrow through a human's foot or a dog's foot pad. Can burrow through the skin, and dogs can be infected that way. So as you see in the life cycle, we have a dog. It is passed through the mother by nursing, not transplacenta, but just nursing. The mother dog then passes them by pooping in the environment. The hookworm eggs are in the environment, and then they're either ingested or they can move through the dog's foot pad. Now, the scary thing about that is think about high traffic areas where there's a lot of dogs. There's an apartment complex not too far away from my house, and I was out there at the park with my boys, and they were playing lacrosse, and I was watching as people were coming home from work about 5 to 6 o'clock. And they were coming home, and the first thing they do is they'd run up to their apartment, they'd get their dog, and they'd bring it out to take care of business. And the dogs seemed to favor these 2 trees out in front of this apartment complex. And they would take care of business, and then they'd go back inside. But they're walking all around. Think about how many times dogs have pooped in that area, and all the different worms and eggs that can be in that area. Dogs are sniffing, they're licking, they're even sometimes even chomping and chewing, grazing on the grass. Now with the hookworms, the poo can be gone, but the hookworms can still be there, and they can actually migrate through the dog's foot pad and into the dog, as you see there in number 7. Or into people. They can migrate into people. They won't go into the people's circulatory system, but it will leave a red trail in the foot and kind of see where the hookworm is migrated through the human's foot.
Russ, tell them about Plumber's Back.
Go,
Plumber's Back.
I'm not sure. Sorry. No.
This is a national board question. So plumber's back is when in trailer parks where plumbers have to go on their backs underneath the trailers where people let their cats and their dogs poop under the trailers, they would come out and they'd be like, wow, why do I have this little like red circular track going up and down my back? And it's because they would roll on the ground to get underneath to check the plumbing under a trailer. And then they would get hookworm migratory events on their back called plumber's back.
That makes sense. I didn't know.
That was a national
I
board
thought you
exam
asked me what
question.
plumber's crack was. I know what plumber's crack is.
We do not talk about plumber's crack here at the Utah Dog Park.
So yes, there's a difference between plumber's crack and plumber's back. So thank you, Dr. Pam.
I'd rather have plumber's crack.
So hookworms, this is what a hookworm looks like underneath the microscope. And hookworms, they do really well against chemicals. It's very hard to kill hookworm eggs. So, they're resistant to Clorox and borax. So it's really difficult to get rid of a hookworm infection. There are zoonotic risks. They can migrate into the people, like Dr. Pam talked about. So these are some clinical signs of hookworms in dogs. And while you're reading those, I'm going to kind of talk a little bit about these pictures up here. The top picture is the same one that I showed before. This is color, and so you can actually see the hookworm's mouth and how it can chew and migrate through there. The second picture is of the dog's internal intestines. And what's happening is these hookworms are actually burrowing through the dog's intestines, which can be painful. And one of the clinical signs they don't have up here is that a dog will sometimes scratch or nip at its stomach because it is painful while those worms are burrowing through the intestines. So this is we'll talk about this worm and then we'll talk about tapeworms, but can anybody guess what this worm is? This is the whipworm. As you can kind of tell from the picture up there, looks like Indiana Jones's whip, and that's how it got its name. This is the least common worm that we will see here in Utah. We will not see whipworms very often here in Utah.
But we do.
We do see them, and they are here in Utah. Yes. Thank you, Dr. Braham. So the whipworm, this is what a whipworm egg looks like underneath the microscope. It's easy to identify because it's a football shape. Whipworms, they are, again, very hardy into the environment. They can resist the environment. Not as hardy as the roundworms, though. Roundworms can last 5 to 7 years. Whipworms can last 3 to 5 years. So whipworms can stay in the environment for 3 to 5 years. They do well away from UV light, so underneath the grass, underneath the first layer of soil. And once an animal is infected with whipworms, they're prone to reinfection. It's just because those eggs are in the environment and they're picking them up again and again. These are some signs of clinical signs in the dog to look for. And this is the whipworm life cycle. The whipworms have the most simple life cycle out of all the worms we've talked about today. They have to be passed into the environment by the dog's pooping, and then they have to be ingested. And again, let's go real quick. Think about that kid in the backyard, fingers in the dirt and everything, and then sucking on the fingers. Even adults can get them. Gardening, pulling weeds in the backyard, go inside, they wash their hands, make a sandwich for lunch, and underneath their fingernail is some leftover dirt, and they might get it that way. So let's talk a little bit about tapeworms, and then we'll close up the evening. Tapeworms are the worms that you will see the most common. I'm pretty sure everybody here at Animal Care Center has seen tapeworms before, and this is a picture of a tapeworm right here. As you can see, each tapeworm, the tapeworms have little sections on them, and each one of those little sections is called a proglotta. And the proglottas are capable of independently reproducing by themselves. They're full of eggs. So those proglottas are actually shed in the dog's poop. And we'll talk about it. I have a picture here. There are 3 common tapeworms that are in pets. And the nice thing about Interceptor Plus is it kills all 3 of these tapeworms. Each tapeworm has a different intermediate host. We have small rodents to mammals, to fleas, and then to larger animals like sheep, cows, and horses, deer, and elk. I'm going to move real quickly through these life cycles of the tapeworms. As you can see, it's passed into the environment, a smaller animal eats it, and then the dog or cat can eat that, or they can eat the eggs in the environment. This is a tapeworm that you can see is zoonotic risk. It has the person on the left there. Usually when a person contracts tapeworms, they're localized to the GI system, but sometimes, very rarely, they can move into the liver, the kidneys, the liver, the lung, or the brains. And if that happens, it's a much more severe case. So let's talk a little bit about tapeworms. I don't have the picture that I wanted to show, I'm sorry. But tapeworms can show up in the dog's poo. They look like a little piece of white rice or almost a clear rice, and those are the proglottas. And they can wiggle sometimes. And so a lot of the times you'll see that in the dog's poo. This is the worm that will have the most complaints from owners of dogs, and it's because they can actually see it. The other worms, you can't see the eggs unless a dog poops out a full, like, roundworm, spaghetti. But a lot of times, owners will see the little white rice or the proglottas that are in the dog's poop, and they'll come in and they'll say, oh my goodness, there's something in my dog's poop, it has worms. It freaks the owners out, and then they want it fixed right away. So tapeworms are the ones that are going to get the most attention, if that makes sense. So the nice thing about Interceptor Plus is it treats and controls all of the internal parasites. And what I mean by treats and controls is it kills all of these internal parasites that we have talked about. Now, heartworm, it just prevents heartworm. So that means that you have to give it every month, and it will not kill adult heartworm like I talked about. You have to do the imiticide injections that Dr. Pam talked about. But if your dog has any of these worms, Interceptor Plus will deworm them, and given every single month, it will prevent them from getting the worms again. So I'd like to say thank you for having me out. I'd like to thank Dr. Pam, and appreciate all that you guys do.
Thanks so much for being here, Russ. We really appreciate it.
Thank you. Thank you so much. Anybody have any questions for Russ while we still got him for a few minutes?
Any questions on any of the life cycles of the worms, zoonotic risks?
One question that I know I get a lot, especially in an exam room, is, my dog or my cat, they spend most of their life inside. Why do I still need to worry about keeping them on these prevention?
You want to worry about that because your dog will go outside to use the restroom. And it goes outside, and even in the wintertime, and my dog likes to nuzzle through the snow and get into the grass and sniff and lick the grass. Well, we know that these internal parasites, their eggs can hang out in the environment for a long time and survive the freezing winters. It can actually be ingesting eggs and become positive for these internal parasites, which then put our families at risk for zoonotic reasons.
And I say the exact same thing. And I also add in too, I go outside, I walk around, I have my shoes on, and I walk through all of these surfaces too. So even if I have a cat that, stays inside on the comfy couch all day, I'm still wandering around, potentially exposing my pet to these parasites as well. And then these are things that in turn just kind of pass throughout the whole family too. Yeah, so Leah just said that we had our heartworm kitty that we had recently was an indoor only kitty. So mosquitoes and things, we do our best to keep them outside, but they do come in the houses as well. Oh, yeah.
So just because we love you people who come and show up for our client service nights, we decided to donate a year of heartworm prevention for whichever person who wins, for whichever dog they choose. So Leah and Jordan are going to draw for that. And there's only, 8 of you here that are here tonight that are not my employees. My employees already get taken care of very well. So somebody will win a year's supply of heartworm. And then Dr. Lindsay is going to talk about Giardia, which is one more parasite that is separate from Interceptor Plus that Interceptor Plus doesn't take care of. Okay, who is it? Jordan. Annabelle Navarro. Yay! Okay, so thank you for coming. And for everybody who's watching, we hope that you will join us next time on our Tuesday night seminar series. Here's Dr. Lindsay talking about all other important parasite things.
Thanks. I was actually going to pull up a little map too so I could show you. I was looking at this the other day as I was getting ready to kind of start talking a little bit more about this lecture. And I was looking at this statistic, and it's for Giardia. So this really, really kind of blows my mind. So Giardia is a really common intestinal parasite that we see, particularly within the summer months. We see it a lot because our pets are more active, and this parasite likes to hang out in water sources. So when our dogs are outside swimming, playing, drinking out of puddles, things like that, they can become exposed. And this can actually make pets pretty sick. I'll be honest, I'm an avid hiker. My dog got this last winter, and he got really sick, like ultrasound, fluids, hospitalized, affecting his liver sick. So it's no joke. And one of the things that really surprised me is when I was looking at these statistics, we found out that in all of the dogs that are tested within Salt Lake County, 12% of them, over 12% of them are coming up positive. So one of the new things that the Animal Care Center is doing to be proactive and make sure we're trying to make sure that your pets are as healthy as possible, and we try to get this number down because that's incredible, is we're starting to screen fecal samples more frequently, and we're actually going to be doing that now twice a year. So you may see those recommendations come through when you come and talk to one of our technicians, one of our lovely front desk staff, or one of the doctors as well. But we're very, very excited to help be on the forefront of getting these intestinal parasites under control, so that way our dogs can be active, enjoy themselves in a healthy way, and then keep your family safe as well. But any questions or things? I just thought that was the one last little plug I wanted to make because we see the Giardia quite commonly, particularly this time of year.
Is there anything you can do when you take your dog hiking or walking or whatever to be proactive so when they do drink out of something?
The hard part is there is not a prevention technique for the Giardia at this point. So I will be honest, I carry Camelback a lot of times when I hike, and then I carry a collapsible water bowl, and my dog's getting my filtered water out of my water bowl. They make life straws and things too that you can use when you're camping to filter out Giardia. And then the iodine tablets and things will work as well for those if you're out and hiking and don't have access to lots of water. And then just regular checking. So if your pet has any vomiting, diarrhea, is just not acting right, that's a good idea. Just let your veterinarian know, hey, I do a lot of walking with my dog, particularly around, water sources, things like that, and they may recommend screening a fecal sample to screen for Giardia.
They can get that from just swimming in the water too.
Yes.
My dogs, every time I went to Tanner Park, every time they got sick. So because there are just so many dogs in that water.
So They can, and that's what makes Giardia really challenging, is because there's this whole population of dogs that carry Giardia that never get sick from it, but they infect all these other dogs who then can in turn get sick. So that's why we screen all of our patients, and we're going to start screening them twice a year to catch those dogs that are not symptomatic and treat them to help protect the rest of the pet population. And then even those dogs that are asymptomatic right then, if they go through a period of stress like boarding, going on a car trip, even having something like house guests, you can see a flare up of diarrhea or vomiting after that. Yes. So the question was, once a dog tests positive for Giardia, will it always test positive? And that leads into, so how do we screen for Giardia? So Giardia is screened for a little bit differently than some of the other intestinal parasites. So they're not only looking for what are called the cysts, which is the infective type of Giardia, but we're also looking for antibodies that indicate that a pet's been exposed to Giardia. So it's a special test that's run just for Giardia. So after an infection, so if the dog is exposed, they can test positive for the exposure, but have actually cleared the infection. But if they're acting symptomatic at all, we typically do recommend treating those dogs, because that's a little bit of a tricky bug, because the GI tract's not always getting rid of those little infected cysts. I know. All right, any more questions on Giardia? All right. Thank you all for coming tonight. It was wonderful seeing you, and we hope to see you back the first Tuesday in August. We'll see you soon.